I'm Dr. Johny Cherian, consultant physician working in Quarantine Hospital, Manjeri. We'll discuss about how to take care of heart in diabetes. In today's session, we'll discuss about the diabetes, its complication and impact on heart, as well as preventive measures for people with diabetes to prevent heart disease. At present, heart disease remains the leading cause for hospitalization and death in patients with diabetes. Although most people have heard of heart disease, few understand exactly what it involves and, in turn, may not be taking proper steps to reduce the risk of heart disease. Heart disease occurs when blood circulating to the heart is slowed or stopped because of a blocked artery. What can be the reason behind the blocked artery? One of the major risk factors is blood sugar level, also known as diabetes. Let us know, what does the diabetes exactly mean? Diabetes is a lifelong disease that affects the body's ability to control blood sugar level. In simpler words, it is a condition in which the body has too much of glucose in the blood. Let us understand, why does this happen? When you eat food, the glucose enters into the bloodstream. Further, the insulin, which is a hormone, break down the glucose from the blood into the cells, and it will be stored and it can be used for energy. With diabetes, your body either does not make enough insulin or can effectively use insulin to break the glucose. This leads to high glucose level in blood or diabetes. Did you know diabetes can increase your chances of dying from heart disease? It's true. With diabetes, you are more likely to have heart attack. So when it comes to diabetes, prevention is very important as it can affect your whole body from eyes to the feet and especially your heart. In fact, people with diabetes are twice likely to have heart attack or a stroke as people without diabetes. As it is reported that among diabetic people over the age of 65, approximately 68% of the heart they die from diabetes. As it is reported that among diabetic people over the age of 65, approximately 68% die from heart disease. The chance of developing heart disease among people with diabetes is not depend upon how well you control your sugar level. So when we think about diabetes, we should really take thinking about the heart disease as well. Let us see how high sugar level leads to heart disease. High blood glucose can damage blood vessels, worsen the cholesterol level, and make the blood pressure more difficult to manage. Persistent high blood glucose level due to diabetes make the blood vessel more prone to atheroma. This condition is a narrowing of the blood vessel due to the collection of bad cholesterol. When the blood vessel is narrow, the blood flow has trouble reaching different organs in your body, including the heart. A sudden stoppage of blood flow in the heart may cause a heart attack. There are a number of things you can do to lower the risk of heart disease. Understanding the connection between diabetes and heart disease is the first step towards prevention. Diabetes is commonly referred as a lifestyle disease. Managing diabetes requires patients to make significant and lifelong changes in lifestyle. These changes require lifelong commitment from the patient. One can control blood sugar level to help lower the risk of heart disease by changing the lifestyle, such as eating heart healthy food and engaging in physical activity, regular blood glucose monitoring, and quitting smoking and relieving stress. Let us see each of these preventing strategies in detail. Know your diabetes in ABC level. A for the HbA1c test. The HbA1c test is a blood test that measures your average blood sugar level over the past 3 months. It is different from blood sugar check you do every day. You need to know your blood sugar level over time. HbA1c goal for many people with diabetes is below 7. It may be different for you. Ask what should be the goal. So in order to have decrease in complications, we need to keep the blood sugar level around HbA1c level around 7. B for blood pressure. Blood pressure is the force of your heart against the wall of your blood vessel. If your blood pressure gets too high, it makes your heart to work too hard. The blood pressure goal for most people with diabetes is below 140/80 millimeters of mercury. It may be different for you. See, for cholesterol, we have bad and good cholesterol. The bad cholesterol is LDL and the good cholesterol is HDL. LDL is low density lipoprotein. The HDL is high density lipoprotein. LDL is bad cholesterol, can build up and clog your blood vessels. It can cause heart attack or stroke. HDL is a good cholesterol, helps to remove the bad cholesterol from the blood vessel. Ask what your cholesterol number should be. Your goal may be different from other people. If you are over the age of 40 years, you may need to take a statin to control cholesterol. Eat healthy and well balanced diet. There is no one size fit all approach to eating healthy, but it is important to have a regular meal pattern and make healthy food choices. Your fat and carbohydrate intake are crucial to manage both diabetes and heart disease. Make simple switches from saturated to unsaturated fat. Having too much saturated fat can increase your blood cholesterol level. So it is important to reduce the amount you eat and instead get fat from unsaturated sources. Switch butter and ghee for unsaturated vegetable oil and spread with sunflower oil, olive, rapeseed, or corn oil. Trim visible fat from meat and remove the skin from the chicken. Choose low fat milk and dairy products and swap biscuits, cakes, and chocolates for healthier snacks such as a fruit. Remember, fatty foods are high in calories and excess energy results in weight gain. To help you to manage your weight, it is important to keep an eye on total amount of fat you are consuming. Different fat types have different effects on the body. Diet high in saturated fat are linked to higher levels of bad cholesterol, LDL, in the blood. Eating unsaturated fat instead of saturated fat helps to maintain a healthy cholesterol level in the blood. Eat right. Avoid refined wheat bread and cereals, potato chips and fries, red meats and processed meats, saturated fats and sugar sweeteners, sweetened beverages. Eat food with more fiber such as whole grain cereal, dairy foods, beans, legumes, lean meats and fish, nuts, and healthy oils such as olive oil. Choose foods such as fruits, green leafy vegetables, bread and cereals, and low fat or skim meal and cheese. Cut down salt. Too much of salt linked to high blood pressure, a major risk factor for heart disease. Most of the salt we eat is already processed food. Check the labels and go for those with the lowest salt content. Learn how to read the labels to help you make healthier choices. Remove the salt shaker from the table to stop you adding extra salt. Try adding flavor to your food using herbs, spices, black pepper, lemon juice in place of salt when cooking. Here are some tips diabetic patients should consider. Eat balanced diets, eat a reasonable amount of calories, eat regularly at time, mean right time. Do not skip meals to keep your blood sugar level go down. Eat slowly. Try to maintain a healthy weight and engage in regular exercise. Weight loss may improve your cholesterol and triglyceride level, blood pressure, and your diabetes. Start with low intensity, short duration workouts and regularly increase the intensity and time. Gradually increasing intensity and duration of exercise is important. Be careful if you already have complications of diabetes. Aerobic exercises such as walking, swimming, cycling is recommended for patients for more than 3 days in a week. So you can have a warm up walking, a brisk walking, and a cool down walking. So you start walking, a warm up walking for 5 minutes, and slowly you change the gear to a brisk walking, and that you can do for 5 to 10 minutes. And every week you can increase 2 minutes so that your system will adjust to your exercise and you will not feel anything odd. And followed by the brisk walking, you can do a cool down walking for another 5 minutes. So 5 5 5 you can do for the first week. The second week you can add 2 minutes to the brisk walking. So 5 minutes warm up, 5 minutes brisk, and 5 minutes cool down for the first week. And second week, 5 minutes warm up, 7 minutes brisk, and 5 minutes cool down. So when you complete 3 months, you'll be covering 5 minutes warm up, 29 minutes of brisk, up to 30 minutes brisk, and 5 minutes cool down. So 40 minutes. So your system will get adjusted to it. If you are having comorbidities, you have to be careful while doing the exercise, and you should seek the help from your consulting doc, uh, physician or cardiologist before undertaking exercise. So medical treatment for diabetes. Take your medications exactly prescribed by your doctor. Eat meals and take medications regularly at right time. Always remember that there is a risk of hypoglycemia if you delay your meal time or eat less than usual. Medications must be supported by healthy eating and regular physical activity. And do not stop your medication during the days of illness. So you can modify or reduce the dose. Most of the people will stop the medication. Omission of diabetic management can raise the sugar well, and they can go to diabetic ketoacidosis. It's a dreadful complication in diabetes. Quit smoking and stopping harmful use of alcohol are equally important. Unfortunately, many people who have diabetes, they smoke. Smoking increases the risk of developing type 2 diabetes and diabetic complications. It increases the insulin needs and increases the risk of hypoglycemia. Smoking cessation is considered as an essential part of diabetes care. Cope with stress as best you can. Stress is known to have raised your blood sugar. Instead, try meditation, deep breathing, or another relaxation technique to beat the stress in healthy way. Quality sleep is another good heart health. Get 7 to 9 hours of sleep every night. The bottom line is diabetes can lead to serious medical complications, including heart disease, but you can manage the condition with medication and lifestyle changes. Avoid the most common diabetic complications with preventive tips. Thank you.